Hello everybody, this is Gareth Cahoon Speaks back here with another video. I'd like you to hit the subscribe bar or give me a thumbs up if you like the content, or hit the notification bell to be notified when I post my next post, or drop me a line and let me know what you think of the videos or where you're from. And if you'd like to look at my website, you can do so at www.garethcahoon.co.uk. Or if you'd like to support the ministry, you can also do so by garethcahoon3@gmail.com on PayPal. This one is about Israel's health figures after over 2 years of war. 24,000 hospitalised, 500,000 required mental health services. The Israeli Health Ministry published its conclusions on Wednesday following a review of its operations during the October 7th war, including lessons drawn from the health system's performance during the war and during Operation Rising Lion. The report said that over the course of the war, approximately 24,000 were treated in hospitals, while the National Institute of Forensic Medicine identified and determined the circumstances of death of about 1,765 people, including those killed in the war and deceased hostages. Approximately 435,000 people were treated at mental health clinics in 2025, a 30% increase from 2022. Some 1,600 soldiers and victims of terror attacks were hospitalised for rehabilitation. Key lessons cited by review teams led by Professor Amon Afak included the need to establish the status and scope of a senior national hospitalisation authority, ensure continuous 24/7 staffing of an operations centre at the Health Ministry's headquarters even in peacetime, enhance the readiness of Magen David Dome and the other first responders both in times of routine and in emergencies, increased medical stockpiles to levels sufficient for 2 months of sustained operations. As for the sensitive topic of providing medical care to terrorists, it was recommended to establish a formal procedure and standards and to set up a dedicated facility in cooperation with the prison service and/or the military police, while allocating responsibilities between the relevant organisations. The review teams also called for the establishment of a national clinical rehabilitation registry, featuring an update and continuous database for the creation of a coordinating body to direct patients to rehab based on bed availability and place of residence, and the adjustment of rehabilitation bed standards to evolving needs while expanding professional staffing across all rehabilitation fields. The review teams noted the importance of diversifying how wounded soldiers are transferred from the battlefield to hospitals, making greater use of regional medical centres rather than relying solely on major hospitals. The report also found that IDF casualties received high quality care during the war, supported by frontline treatment, swift evacuation, triage, and effective use of healthcare resources, with military figures including some of the lowest wartime mortality rates on record. The ministry's data included the mortality rate of patients evacuated to hospitals on the first 2 days of the war, October 7th and 8th, 2023. On those evacuated on October 7th, the death rate was 0.6%, and on October 8th, it was 0.4%. Among critically injured patients evacuated on those 2 days, the mortality rates were 6.9 and 6.8 respectively. These mortality rates are low by international standards, even though the scenarios of which the healthcare system had prepared were significantly more limited in scope than the scale of the attack. According to the Health Ministry, the onset of war coincided with swift changes at Sukkot and Barzilai hospitals, with 2 shifts and reinforced teams were on duty simultaneously, enhancing response capabilities in the light of the number of casualties. Secondary triage was activated with roughly 150 patients transferred to hospitals in central Israel on the first day. Regarding rising tensions with Iran, the Director General of the Health Ministry noted that in recent days meetings have been held with the military and healthcare organisations to ensure continued readiness. The alert level in our system has not increased, but we are enhancing our preparedness, recognising that we operate in a security environment that is constantly evolving. So this is how Israel has coped with the war this past 3 years. And in my book, they have done an exemplary job. And hats off to all the spirited men and women who came in on October 7th and October 8th and had to deal with the consequences of a genocidal organisation bent on the destruction of Israel and her people. The medical services need an award for what they done on October 7th and 8th, and even after that. These people are what makes Israel great. Israel isn't great because of the country. Israel is great because of her people. Israel High, the people of Israel live, and no devil in hell can change that. Shalom, Maranatha, and Hallelujah.